Welcome to Samba Samba. Enjoy the video.
You start by confirming the patient and pain score. This tells you the right med and dose. Next, access the med cart or dispenser, use the keycard or in-game permission, because without access you can't proceed. Once inside, locate the correct drawer and medication label, match the 6 rights. Do this now so you avoid errors later. Keep tools ready, chart, pen, and any pop-up prompts, because the simulator checks timing and documentation as you move to administration. Once you have the med, prepare the exact dose in the tray or dosage screen. Adjust for concentration if required, because an incorrect volume triggers errors. Then verify patient identity twice, name and DOB, and ask the pain level now so you document baseline. Follow the on-screen route instructions. Some meds need oral, others require assistance. Put on gloves, have water ready, and confirm the time window is valid. This reduces mistakes and ensures the simulator records correct practice. You give the medication per the required route, watch the avatar swallow or follow prompts for assistance. Doing this ensures the simulator marks the action complete. Immediately document the medication, time, exact dose, and the patient's post-dose pain rating, because accurate records close the task. Once done, return the cart and sign off. If something goes wrong, pause, read the error message, recheck permissions, and med match. Then retry or notify a supervisor in Sim so you preserve patient safety and task completion.
Thanks for watching. Consider subscribing if we helped you.